Orthopedic surgery, or orthopedics, is the branch of surgery concerned with conditions involving the musculoskeletal system. Orthopedic surgeons use both surgical and non-surgical means to treat musculoskeletal trauma, spine diseases, sports injuries, degenerative diseases, infections, tumors, and congenital disorders.
I have arthritis and started to get a lot of pain in my right hip and both my knees, and actually could not walk.
As a board-certified and fellowship-trained total joint surgeon specializing in adult reconstruction, Dr. Nathan Cafferky focuses on patients with hip and knee conditions who require replacement surgery.
Taking care of others and putting others first is one of the most rewarding aspects of being an orthopedic surgeon. Early on in my education, I realized that I wanted to help get people back to doing the activities they love. I'm lucky to work with a group of dedicated, experienced, caring professionals who excel at their roles. Our patient care philosophy is to work closely with our patients on an individual basis to establish appropriate goals of care and expectations. Joint replacement is a journey that requires dedication, innovation, and experience from your healthcare team. That's why we leverage newer technologies and techniques that help improve our patient satisfaction and outcomes. With total hip and total knee replacement surgeries, we're using less invasive procedures. Combining these newer techniques with rapid recovery post-operative protocols allows patients to return to their normal lives faster.
Dr. Cafferky tells us about the latest state-of-the-art technology in robotic knee replacements.
In my practice at Vail Summit Orthopedics and Neurosurgery, my team has embraced the role of robotics in the operating room. The Zimmer Biomet ROSA robot, which stands for the Robotic Surgical Assistant, has the potential to improve outcomes following total joint replacement surgeries. The Zimmer Biomet ROSA robot is a device that is composed of two units. One is a base unit that carries the robotic arm, and the other is an optigational navigation system that allows the surgeon, myself, to control the movements through a sterile touchscreen. The role of the Zimmer Biomet ROSA robot is to provide the surgeon with more objective data during the time of surgery. With more objective data allows the surgeon to perform a more scientific restoration of the patient's biomechanics and kinematics of the knee joint. With all this information, again, we are able to restore a patient's kinematics to meet their individual needs, and with that information, we're seeing some pretty amazing outcomes.
I would definitely recommend Dr. Cafferky to both my friends and family because he is on the cutting edge of technology. He uses the ROSA, which is the robotic assist device, and I know it helped make my recovery faster and less painful.
My experience with both Dr. Cafferky and his team was great. The surgery went well. I was out within a couple hours. Started rehabbing a couple days after that, and 6 weeks after my surgery, I'm out on my bike doing my thing, and that was the most important thing for me.
Dr. Nathan Cafferky and his team take the time to fully understand the nature of your injury, your overall health and fitness, as well as your particular lifestyle. You'll get a personalized approach to joint reconstruction and recovery that includes physical therapists, athletic trainers, and others. Whether you're a local of the High Rockies or a patient traveling to their mountain community, Dr. Cafferky and his team will move you forward with innovative orthopedic care.